Good morning. I'm Phil Marella. My wife Andrea and I have 4 children, 2 of whom were born with NPC. And like many families, we started our life together with expectations of unending joy. But then NPC changed our priorities. Our second oldest, Dana, was a beautiful, fun, caring, and insightful little girl. As an infant, her doctor felt just the tip of her spleen, but it would come and go. Still, that led to specialists and many tests, including a painful bone marrow scrape to check her for leukemia. They found no cause, decided it was likely a viral reaction, and we were told to go home and enjoy our daughter. But then at the age of 5, we were stunned to hear that Dana was falling well behind the other children in school. And that started a 3-year journey of seeing specialist after specialist with no answers, until that terrible day we learned that Dana had NPC, and were told that there were no treatments available, and we had only another 5 or 6 years with her. The time between the skin biopsy to the NPC confirmation was excruciating, and the confirmation was a gut punch. With the amazing efforts of this community providing our first experimental treatment and drug trial, Dana was with us another 12 years. But they were not easy years as Dana declined. Seizures, a special walker by the age of 9, a wheelchair and feeding tube by 12. By the time Dana was 14, she couldn't walk or talk, got all of her nutrition and medicines through her feeding tube, and required 24/7 care. Even after she no longer spoke, she always greeted people with a smile, and she loved to hold hands. The last 5 years were the toughest, with multiple pneumonias, long stays in the hospital, eventually needing a trach and a ventilator to breathe, until one fateful week during a seemingly good period, just before her 20th birthday, suddenly Dana's liver failed and she was gone. Our youngest child, Andrew, like Dana, had the occasionally enlarged spleen at less than 1 year old. And while Andrea and I both feared the worst, we hid from the possibility that Andrew also had NPC. Yet with the start of the first drug trial, we knew we had to know for sure, with the chance that he could get a head start with that experimental treatment. So just before his 5th birthday, we received the terrible news that Andrew also had NPC. But it was the right choice because we believed that with the help of that medicine, Andrew thrived from 5 until 14. People rarely noticed any difference between Andrew and his friends. With the help from a second drug trial, Andrew is still an amazing speller and very good at mental math. But NPC is a relentless disease. 3 weeks after Dana passed, Andrew, a 14-year-old boy who would walk home from the school bus, play baseball and flag football, starting having multiple seizures per day. Andrew now has gait, balance, occasional swallowing issues, but we don't know if it's NPC or the side effects from all his anti-seizure medicines. And of course, with the loss of Dana, he expresses fears for his own future, no matter how encouraging we remain. Andrew's seizures now average about 1 every other day, but Andrew cannot be left alone, cannot move around the house or anywhere else without someone by his side. So in one day, his entire world was turned upside down. It has been almost 6 years since we lost Dana. We think of her every day. It's those memories and the faith that Andrew and the other patients here and everywhere will be the first ones to see a cure for NPC that pushes us to help unlock the answers to this terrible disease. Thank you.